Welcome to St. Vincent Charity Medical Center's Center for Bariatric Surgery online seminar. We're here today to help you understand a little about obesity, the kinds of bariatric surgery, whether you're a good candidate for one of them, and what to expect if you are. Obesity is a disease, and it's only in the last 10 or 15 years that we've begun to view it as such. Obesity is measured by body mass index, or BMI. BMIs range from a healthy low of 18.5 to 40 and up, which is morbidly obese. Patients with higher BMIs can have a significant increase in comorbidities, which are other health issues that include diabetes, high blood pressure, sleep apnea, and fatty liver, as well as high cholesterol and triglycerides. The incidence of comorbidities goes up significantly as BMIs top 35 and even more so over 40. Having a high BMI makes you a possible candidate for surgery. If you have central obesity plus any two of the following: elevated triglycerides, reduced HDL, elevated blood pressure, or type 2 diabetes, then you have a group of risk factors known as metabolic syndrome. And we know that people with metabolic syndrome are at increased risk for heart disease, stroke, and early death. What's more, some cancers are directly linked to being obese. As you see here, endometrial cancer is directly related to obesity in nearly 50% of cases. There are successful surgical treatments proven to significantly reduce or reverse obesity-related diseases. As one bariatric surgeon said, it's really pretty amazing how quickly a lot of these health problems go away. In many cases, our patients who are on insulin for diabetes will leave the hospital after surgery with either a lower dose or no longer require insulin. Unfortunately, if you have a BMI of 40 or more and you do nothing about it, you will have an increased risk of shortening your life by 8 years. Significant weight loss through diet and exercise alone has a success rate of 5 to 10%. People often lose weight through diet, but then gain it back and then some. To put the risk of bariatric surgery into context, consider that the mortality rate for the procedure itself is under 0.5%, making it about as safe as common surgeries like hysterectomies and gallbladder removals. Please note that the mortality risk associated with certain comorbidities and health conditions is a little higher. Clearances you'll need prior to surgery are decided based on your medical history and the medications you take, so depending on your age and background, they can include cardiology and pulmonary. If we suspect you have sleep apnea, a condition where you stop breathing for several seconds at a time when you are sleeping, you will need to have a sleep study. If the test shows you have sleep apnea, you will get fitted with a mask that helps you breathe better while you are sleeping. Every prospective patient visits a minimum of 3 times with a dietitian, depending on your specific insurance requirements, and has a psychological evaluation. Some insurance companies require 3 or 6 visits to the dietitian, and still others require 9 visits. There is also blood testing, and you must quit smoking. Finally, there is pregnancy counseling for women in their reproductive years. We ask that you not get pregnant for about 2 years after surgery, due to vitamin and nutrition deficiencies that can affect a baby. Some patients may not be candidates for bariatric surgery, and while certain conditions, such as Parkinson's or certain autoimmune diseases like Crohn's disease, rule out one procedure, it doesn't necessarily mean one of the other bariatric procedures can't be done. Likewise, kidney failure or kidney transplant patients may not be candidates for one surgery, but again, one of the other bariatric procedures may be appropriate in these cases. Of all bariatric surgeries, gastric bypass has been around the longest, about 60 years. In gastric bypass surgery, access to the abdominal cavity is gained through a series of small incisions in the abdomen. Devices known as trocars are placed into the incisions. They serve as passageways for surgical instruments, like the laparoscope, which the surgeon uses to examine the abdominal cavity. A small stomach pouch, which restricts the amount of food that can be eaten before feeling full, is created using a stapling device. The small intestine is then separated into 2 sections, and the lower part of the small intestine is then attached to the newly created stomach pouch, allowing food to pass directly into the small intestine, where digestion continues. Bypassing the upper part of the small intestine decreases the absorption of calories and nutrients. The upper part of the small intestine is then reattached to the lower portion, allowing bile and pancreatic fluids to complete the digestion of food. With gastric bypass, the average excess body weight loss, even in longer range studies of 15 to 20 years, is about 65 to 75%. Applying those numbers to the real world, it means if you lose 100 pounds and you gain some back, you'll still be 65 or 75 pounds lighter than when you began. With gastric bypass, something called dumping syndrome can occur as a result of eating foods that should be avoided, especially those high in sugars and carbohydrates. Dumping syndrome usually starts with shaking and sweating and can feel like hypoglycemia. Though it usually lasts only a couple of hours, it can go on longer, and in some cases has resulted in hospitalization. Working with and listening to your dietitian can help you avoid the unpleasant symptoms of dumping syndrome. The sleeve gastrectomy is a permanent procedure that restricts the amount of food you can eat by reducing the size of your stomach. This procedure also begins with a series of small incisions in the abdomen. Likewise, trocars are placed in the incisions and surgical instruments are passed through the trocars to access the abdominal cavity. The surgeon uses a laparoscope to examine the abdominal cavity, including the stomach, which can expand to hold up to 1.5 liters of food and liquid, a little less than a 2-liter bottle of soda. To perform a sleeve gastrectomy, the surgeon uses a stapling device to create a thin, banana-sized sleeve in the stomach that typically holds from 50 to 150 milliliters, or about 1/10 of what it could hold before. Unlike bypass, the excised portion of the stomach is removed, and there is no rerouting of the small intestine. So there tends to be no dumping, because the pylorus sphincter that empties the stomach remains intact. What's more, there is a decreased risk of vitamin deficiency. The sleeve gastrectomy can be used in patients with Crohn's and some other autoimmune diseases. A recent 5-year study shows the average excess body weight loss experienced with gastric sleeve to be around 60 to 65%. As with bypass and gastric sleeve procedures, gastric band surgery begins with making a series of small incisions in the abdomen. The placement of trocars accommodates the surgeon's tools, including the laparoscope, which the surgeon uses to view the abdominal cavity. To prepare for the gastric band, a tunnel is created behind the stomach. The band is introduced to the abdomen through a trocar. The band is then positioned around the upper portion of the stomach and secured using a locking mechanism. A tube connected to the band will be attached to an injection port, which is used to adjust the band's tightness after surgery. An incision is then made in the upper abdomen to insert the injection port. The injection port and tube are connected and placed under the skin. Like gastric sleeve, there tends to be no dumping, there's a decreased risk of vitamin deficiency, and gastric band can be used in patients with Crohn's and some other autoimmune diseases. Around 6 weeks after surgery, you will visit your surgeon and begin a series of adjustments to your gastric band. These adjustments may be necessary for as long as you have the band. Adjustments are made by injecting saline into the injection port. The saline travels through the attached tube to the gastric band, expanding the band and creating a smaller upper stomach pouch, which restricts the amount of food you can eat before feeling full. It can take 4 or 5 adjustments during the first year to reach the right setting for you, which is the point at which you're not hungry in between meals, but losing weight at 1 to 2 pounds a week. Unlike the results of bypass and gastric sleeve procedures, where most of the weight is lost within the first year, gastric band weight loss occurs over 2.5 to 3 years. So to recap, the majority of weight loss with both bypass and sleeve is between 12 and 18 months, but about 3 years for the band. All are performed with a laparoscope and are minimally invasive. While hospital stays average 1 to 2 days, when it comes to recovery time, it's recommended you plan on taking off around a month. This is simply because it takes about that long for your body to heal and for you to adjust mentally to the way you have to eat. Of the 3 procedures, only bypass requires modifying time-release medications, and only the band requires adjustments. And most insurances cover bariatric surgeries. Insofar as excess body weight loss is concerned, bypass results are a little higher than those for the sleeve, which are in turn a little higher than those of the band. Remember, these bariatric procedures are tools to help you achieve and maintain weight loss. But to keep the weight off, you must use the tools correctly, and that means making some lifestyle changes. Each year, more than 300 people trust the Center for Bariatric Surgery at St. Vincent Charity Medical Center for their weight loss procedures. Since 1997, we've helped more than 7,000 patients lose more than 700,000 pounds. It's trust well earned. We were the first center in the region to be named as a Bariatric Center of Excellence, a requirement of many health insurers for program eligibility. Attaining and keeping this designation required and continues to require that our program maintain the highest levels of safety. Ultimately, though, it's because we put you at the center of a lifelong partnership that extends beyond surgery and beyond the doors of our hospital to keep you informed, aware, and supported as you move forward with your new lifestyle. Thanks for viewing our Center for Bariatric Surgery online seminar. We hope it's been informative and answered any questions you may have about weight loss surgeries. To find out more, hear patient success stories, or get started with an appointment or consultation, please visit us at stvincentcharity.com/bariatrics or call 216-592-2801. We look forward to helping you take positive steps towards the healthy lifestyle you've been dreaming about.